Hello everyone, I am Dr. Shorain, Director of Shorain's Vein Care Center located at Medanta, the Medicity Hospital, Sector 38, Gurgaon. Today I will speak about latest, most advanced, innovative treatment for varicose veins of the leg. Varicose veins पैरों की एक ऐसी बीमारी है जिसका प्रीवेलेंस, जिसका हमारे सोसाइटी में इतना ज़्यादा प्रकोप है कि मैं जब भी आई यूजुअली गो फॉर वॉकिंग morning and evening. I usually go for tennis, badminton and at social events. ऐसा कभी भी नहीं होता कि मुझे कोई ना कोई शख्स टकरा जाए, जेंटलमैन और अ लेडी हु इज़ वेयरिंग नी लेंथ ड्रेस, कि जिसको वेरिकोस वेन नोटिस नहीं होता. It's not that I look for varicose veins in others' leg, but it is because I treat day in and day out that it gets noticed. So coming to varicose veins is not a dreaded disease, I would say. It's not a life-threatening disease, but definitely it compromises your quality of life. So it can't be ignored. In my experience of last 15 years, I would say, what I have gathered is most of our Indian patients are ignorant to the disease. They may or may not notice ugly veins in their legs. They may ignore it, or some friend may tell about it, and once they come to know that they have some abnormal veins, they may or may not Google it, because most of the varicose veins in their early stages are basically asymptomatic, मतलब कोई symptoms नहीं होते. So you, और जब उनके सिम्टम्स होने लगते हैं, पैर में दर्द होना, हैवीनेस लगना, चलने पे बेचैनी, एक अनोइंग सी फीलिंग, अगली लुक, and in very later stage, especially in those who stand or whose profession makes them stand for pretty long time, like teachers, surgeons, policemen, traffic police, lawyers. So in such situations, especially the chai walas and who stand for 8 to 12 hours for their bread earning. So usually in those patients there may be thinning of the skin, blackening, pigmentation, itching. Sometimes the vein bursts and it bleeds like I would say tsunami, and then they get afraid, and those are the patients who come to emergency. Rest of the patients may come to OPD, and some are very intelligent patient. I would say in last 10 years I have seen slowly, especially last 2-3 years, that patients who go for their health checkups, who notice such ugly veins, they may come to us directly and inquire about it. So coming to varicose veins, there are many treatment available on the market to treat varicose veins, but I would say unless and until you visit a person who is treating vein, or who is a vein specialist, or who is, I would say, a certified well-trained vein specialist, you should not take an advice of the someone who is not dealing with diseases of the veins. It's a very different subspecialty within the vascular field, I would say. So talk about the treatment part. Treatment almost like 25 years ago, I would say, was only surgery. It's a cumbersome, morbid procedure, lot of rest after the procedure, recurrence rates were high, and hence the world shifted towards endovascular method. Endo means inside, endovascular, inside the vein. So you're treating everything inside the vein without cutting the vein. And then the advancement started. So last 10-15 years, I would say, we are doing lot of endovenous treatment of varicose veins by using heat energy. So this heat is emitted either by laser, radio frequency, microwave. So all they do is they take off the abnormal veins, and the blood is rerouted through the normal veins, which is quick, and patient recovers. Now the latest which I'm talking about in this video is, which is offered at, I would say, Dr. Shorain's Vein Care Clinic, normal veins. So what they are doing, they are using a very a device which is basically which emits super glue, or a medical name of that is cyanoacrylate. So this super glue is a medical glue which glues off the abnormal veins, and the blood is rerouted through the normal veins. It's a very quick procedure, no heat, no burn, no paresthesia. Patient can walk in and walk out. It's so quick. And it all depends, the treatment part depends on the stages of the disease. So I would say those patients who come at a later stage may need adjuvant treatment like sclerotherapy, phlebectomy, but usually if they come at a right time to be treated by this new technology which is called as VenaSeal, so sealing the abnormal vein. So I would request the patients to check with your treating physician about this option. And if you still have any doubt, you can visit our website www.vasculardoctorindia.com, or you can WhatsApp on 986 888 7666. Your queries will be solved. So my take home message is, please don't ignore ugly looking, abnormal, prominent veins in your legs. If you notice it, consult a specialist. Nowadays online consult is available. Technology, use your technology, and at least inquire whether it needs a treatment or any lifestyle modification, so that your quality of life is not hampered. Thank you.